Hi, I'm Dr. Thomas McGinn, the Executive Vice President for the Physician Enterprise. Welcome to the 5-Minute Check-In. Today is Monday, December 6th. So as we approach the holiday season, I want to express my gratitude for everything you've all done over this past year. It's been a difficult year, but you've all been outstanding. Also, I want to wish all of you happy holidays and happy New Year. We have a lot to cover today. We're going to start off by talking about the Omicron variant. We're then going to talk about a new treatment that has been published recently in the New England Journal. Going to follow that up by a non-COVID publication and close out by discussing some awards. We have a lot to talk about, so let's get started. While the Omicron variant is capturing all the headlines, we have to be aware that COVID cases are on the rise across the United States due to the Delta variant. There are over 55,000 patients that are hospitalized in the United States. That's not close to the peak that we saw back in September, but it is a 15% increase over the last 2 weeks. And we're feeling it here at CommonSpirit, particularly in the Midwest and the Southwest. So I'm just grateful again for all the hard work that everyone is doing. But let's talk about the Omicron variant. When I think about a variant, I think of 4 things. First and foremost, I think about how transmissible is that virus. Second, I think about how severe is this new variant going to be? 3, I think about, will that variant somehow get around our vaccinations or the immunity that we gained in a prior infection? And 4, how do our diagnostic studies detect that new variant? So let's go back up and discuss the first point. How transmittable is this new variant? Well, the data does seem to show this is more transmittable than the Delta and other variants. Then we look at severity. How severe is the disease that this variant is causing? The data is not out on that yet. They're working on this in South Africa, and we should know in the next couple of weeks. The third point about its ability to get around our vaccines or immunity from prior infection is something that we're looking closely at. There's some very early data that may indicate that it is more transmittable amongst those who were previously exposed. So this is something we have to pay close attention to. And the fourth issue is related to our ability to detect this through our testing. It does seem very clear to us that the PCR is very accurate at detecting this variant and can even tell which variant it is in the moment. The at-home test, the antigen tests, well, it can detect that you have COVID, but will not distinguish between the different variants. So let's go to some recent publications. There was a new publication in the New England Journal about a new monoclonal antibody called Sotrovimab. This is an interim analysis of a randomized controlled trial over 800 patients. Patients were at high risk for hospitalizations, but they were ambulatory. And it did demonstrate a pretty significant impact, a relative risk reduction of 85%. That's a 7% admission rate versus a 1% hospitalization rate. And also of those hospitalized under the treatment arm, none ended up in the intensive care unit. So why is this new monoclonal antibody important? Well, there are 2 big things that the authors emphasized. 1, it appears that it might be effective against all types of variants. And number 2, they may be developing an intramuscular version of this, which could be given at pharmacies and easily given at offices, much different than having to give it intravenously. Another interesting publication in the New England Journal, unrelated to COVID, was a study that was looking at the differences of using spinal anesthesia versus general anesthesia for patients who were undergoing hip fracture surgery. The researchers performed a randomized controlled trial of over 1,600 patients and then followed them out over 60 days to see who would recover quickly in terms of walking and independence. The interesting finding here was there was no difference between the 2 groups. Now, the assumption was always that spinal anesthesia would have better recovery time. So this really brings into question that whole philosophy. And what the authors say is maybe this is really all about patient preference in terms of which type of anesthesia to use. So interesting and provocative article. And now on to the final section, our recognition, the best part of the 5-minute check-in. So congratulations goes out to the Mercy Medical Group and the Dignity Health Medical Network of Santa Cruz. They received the 2021 Excellence in Healthcare Award from the Integrated Health Associations for their top performance in clinical quality, patient experience, and cost measures. Another congratulations goes out to the CHI Memorial Pediatric Diagnostic Associates in Chattanooga, Tennessee, for winning the Best of the Best People's Choice Award. So congratulations to all three groups, and congratulations to all of you for the amazing, dedicated, hard work you've been doing over this past difficult year. I'll see you all in the new year. Have a happy holidays and a happy new year.